Good morning, everyone. We'll give folks just a few seconds to join. Hi, Lisa.
Hi.
Good morning. We'll get started in just a few seconds here. Um, I have one quick announcement before I turn it over to you and Juliana for the presentation. Let me turn on share screen. That's always the part I forget. All right. So we sent out a sign-on letter opportunity yesterday. So we have drafted a sign-on letter to the Massachusetts State Legislature and to Governor Healy and the administration, thanking them for their budget investments over the past month or so, and also I think shedding a little bit of light and talking about what some of the potential funding cuts will mean for early education and care and sort of beginning that conversation. So we posted that, or we sent it out in an email yesterday. I can link in the chat while Elisa and Juliana are presenting. But if you're interested, it's a sign-on letter for organizations and for individuals. So you can go ahead and you can fill out the Google form, and then we'll get that out later this week. The deadline is Friday, so make sure that you fill out the form by Friday, and we'll plan to send it early next week. And with that, we are joined by Elisa Minoff and Juliana Zhou today, who are going to be presenting a little bit about a brief that they put out recently, talking about how recent immigration policies are impacting families from the perspective of childcare providers. So I'll turn it over to you, Elisa, and you can feel free to share screen. We always ask 9:30 callers to talk a little bit about your background and how you came to be in your current role, and then feel free to jump right into the presentation.
All right, thank you. So I'll start and then I'll turn it over to Juliana to introduce herself. My name is Elisa Minoff. I work at the Center for the Study of Social Policy. I've been in various roles at CSSP for I think 8 years now, and manage our economic justice policy work where we do a lot of work across policies that affect families with young children, and young adults. So we work on childcare and caregiving policy. We work on direct cash, and policies like the child tax credit and paid leave. Um, and I got into this work back right straight out of college, really. When I moved back to DC, which is actually my hometown. I was one of those kids who did not want to go back home, but was drawn by working in policy, and this was where much of the work that I was interested in is, and took some detours. I went to grad school and did a PhD in history, and still use a lot of that sort of historical analysis in my work in policy. So really happy to be with you all. I'll turn it over to Juliana.
Thanks, Elisa. Hi, everyone. I'm really honored to be here today. My name is Juliana Zhou. I'm a policy analyst at CSSP, and I got into this work mostly through my interest in economic security, what economic security looks like for immigrant families. I grew up in an immigrant enclave in New York City and had a lot of things going for me and my family that kept us on stable economic footing and like gave me the stability I needed to do well in school and to go on and be here in this work today. But there were a lot of other families around me that didn't have those same securities. And there were, my brother and I were able to have health insurance, whereas my parents were not eligible. It was this very interesting mixed bag that made me very interested in how policy works, who's eligible for what through policy. Thank you.
Thanks, Juliana. So I'll start with just some sort of initial sort of framing for the research and explaining why we conducted this research. And Juliana is going to share slides and walk through who we talked to and what we learned from this project. Um, and I just want to start by, first of all, thanking you all and thanking this community, because this research project really wouldn't have been possible without so much support from the 930 community. We began research last year talking to parents, grandparents, and other informal caregivers, as well as childcare providers, to learn more about families' experiences with different care arrangements, and to learn from caregivers about what they would need in order to care for their young children with in the arrangement and with the caregiver that they would like. So we began this research in 3 states. Massachusetts was one of the 3 states. The other 2 states were North Carolina and New Mexico. We conducted over 75 interviews last year, and are still writing up that larger project. But this whole project is done in partnership with a research advisory board of parents. And one of the parents on our research advisory board, I think some folks on this call will know, her name is Hung Vu. She's a parent leader in Boston. And as we were having conversations with Hung and the other parents on our research advisory board earlier this year, talking about the findings from this larger research project, Hung asked, why don't we do follow-up interviews with childcare providers to learn more about what they're experiencing right now? Because circumstances have really changed since the midpoint of last year when we began this project. And we thought that was a great idea. So what we did is we decided, as we were kind of thinking about what questions we wanted to ask and what would be most useful, we really decided to focus on hearing and learning from childcare providers who serve immigrant families, because we were concerned about the impacts or potential impacts of the Trump administration's immigration policies on families with young children. We know that childcare providers have a really particular lens into the experiences of young children and their families because they work so closely with them. And so we decided to do a very quick sort of follow-up research project where we would talk to just a handful of childcare providers in different states, some of whom we interviewed last year, some of whom were new, to learn about what they're seeing among their families and whether they've seen any sort of effects of the Trump administration's immigration policies. Um, this is, as I said, sort of a very small project. We have many partners and know other folks who are doing much bigger research projects to begin to unpack the experiences of families with young children right now, and immigrant families with young children. And it does capture really like a moment in time. We conducted these interviews, as Juliana will walk through, this spring in the course of a few weeks. And so what we're going to share today is really a reflection of what childcare providers had seen and what their families they worked with had experienced up until that point. So I'm going to turn it over to Juliana to share the research and our findings. But I want to say that the conversations we had with childcare providers were often quite emotional and difficult. And I want to thank them just publicly here for talking to us and for everything they do every day to support the families they work with. So, Juliana.
Awesome. Thank you so much, Elisa. So just to get us started, the title of the brief is It's Horrible to Live Like This, Immigration Policies, Real-Time Impact on Young Children. We will provide the brief links in the chat, and I believe it also went out with the description of today's call. So let's move on. As Elisa mentioned, we had a couple of key research questions we wanted to take a look at. I won't go into them too deeply, but essentially we wanted to understand through the perspective of caregivers, formal caregivers, how to see at a very high level how immigrant families and immigrant communities were doing. We spoke to 5 caregivers. All of the names are pseudonyms, and essentially to get a rapid response insight into how things were changing for families. These caregivers served anywhere from 5 to 12 children in their program for those who are center or for home-based, and for the center-based programs served upwards of over 100 children each. And the people we spoke to occupied different roles, from director to family liaison to owner and operator of a home-based childcare program. And they all serve substantial numbers of immigrant families. Anywhere from a quarter of the children that they cared for were from immigrant families up to all of them. And when we say immigrant families, we mean someone in the family is not a US born citizen, whether they have already been naturalized or have a green card or on a student visa. Oftentimes, at least in the context of who we spoke to, it was US citizen or green card holding children with immigrant parents who had any number of different types of statuses. And we specifically sought a mix of geographic areas and program settings and roles, as we mentioned. So to give a rough idea of where we were when these interviews happened, the interviews happened roughly in that like small yellow-green bit of time. This is not by any means a comprehensive timeline of all the immigration-related events that have happened in 2005 or 2004 even, but it's to give a sense of what providers and immigrant families might have been seeing in the news or experiencing or seeing on social media at the time that these conversations happened. Let's what providers told us is that, many of them began hearing about deportation concerns from parents beginning in early January, February 2025. Some of them started hearing from parents as soon as Donald Trump was elected in November, essentially saying, he's been promising mass deportation. What are we going to do if that happens? I don't know what that means. I don't know what that means for my family. And all but one provider that we spoke to saw a decrease in attendance in early 2025. Sometimes that was a pretty sharp drop in attendance. Um, Most of the people we spoke to said that decrease in attendance has mostly leveled off or bounced back by April or May when we spoke to them. Although many also saw an increase in disenrollments where families completely pulled out of their program for reasons that they have reason to suspect are either directly or indirectly related to immigration enforcement concerns. Many immigrant families were also spending less time outside with their children because there have been a lot of highly publicized, well-documented raids by ICE agents in public spaces like malls, grocery stores, and certain families who feel at risk just have seemed to be going out less. This is according to providers who said that they just see fewer people out, or they know that the children that they serve are not going outside to the park as often with their parents. Immigrant families and providers are also, the providers we spoke to also mentioned that the families they serve and also some of their colleagues and employees are afraid of being detained or deported, regardless of their status. We heard stories of childcare providers with green cards who are holding off on their annual trip back home to see their family in their home country because they don't know what will happen and they cannot afford legal representation if they were detained in error. And so there was just a lot of fear, and there have certainly been highly publicized, well-documented cases of US citizens who have been deported, or people with green cards or student visas who have been detained by ICE agents. And so what we heard broadly was that no one really felt safe, regardless of their actual status. And lastly, and really distressingly, children in immigrant families are noticing their parents' stress, noticing that something isn't quite right, even if they don't understand the political context of what's happening. One caregiver we spoke to who serves all children in immigrant families said that several of the children that she works with are becoming alarmed when they hear sirens or asking like, why is mom afraid of the police? And she has to try and explain to them that it's not nec it's not necessarily the police that like their parents are scared of, or that like, no, my dear, it's not this isn't, you're not hearing like ICE, this is an ambulance, and just trying to help children understand the fears that they're seeing in their parents in a way that is developmentally appropriate. We wanted to focus on one particular childcare provider's story just to really personalize the narratives that we heard. This is Christina. Again, we're using pseudonyms for everyone that we mention here today. And Christina is someone who owns and operates a home-based childcare program in California. There are about 12 children in her program, give or take, with some additional part-time students. And she estimates that about 25% of them are from immigrant families. And even though her program is home-based, she has multiple classrooms and employs a few teachers, all of whom are immigrants themselves. She also works at a local college or university with early childhood education students, many of whom are international students. So, you know, with that in mind, Christina is someone who, in the interview, came off as very proactive about understanding how policy affects her program and the families that she serves. She first started proactively having conversations with the families that she works with about their possible immigration fears or possible concerns in November 2024, as soon as Donald Trump was elected. She makes it a point to educate herself and the families that she works with about what their rights are, what her rights are as a owner operator of a childcare program, and make sure to let the families know, let the parents know that if there's a visit from ICE, she has no plans to, open her doors, let them in without, a signed judicial warrant. And she also shared that she was one of the providers who shared that her teachers are afraid to travel internationally, and that even she, who is a US citizen born to immigrant parents, has some reservations about an international trip that she has coming up at some point this year. She shared one story in particular of a family from the Philippines who was prevented from re-entering the US after visiting family abroad. The mother had previously had a student visa that was either rejected or denied or revoked. It was unclear what exactly happened with the mother's student visa status. And as a result, the entire family is staying behind in the Philippines, and essentially reframing it for the child in that family as a prolonged vacation with the grandparents. Although, of course, the mother is distressed about at what point, if it is even possible for her to get her visa status cleared up so that they can re-enter the country, and so that they can resume their lives and be close to family and friends and their community. Christina also worries, outside of what she's seeing with the families that she serves, she also worries about the prospects for future educators, especially with regard to cuts to funding for preschool. In her work with, college and graduate students who are pursuing early childhood education, she said that seeing she believes that anti-immigrant policies across the board will mean that fewer programs, fewer schools will be willing to sponsor work visas for international students upon their graduation. And so it's going to be harder for international students to find jobs after graduating. She mentioned that in the past, an international student that she works with might send out 50 applications for a job where she needs sponsorship and get one response. But now she's anticipating, so it wasn't easy to begin with, but now she anticipates it will likely be even harder to hang on to, these graduates who have trained in the US and want to work here, but see a lot of obstacles to doing so. She also worries that cuts to preschool funding will mean that only the wealthiest families in her area can afford childcare, because even, middle class families can't afford to send multiple children to childcare at full tuition. And so that would be a huge blow to the diversity of her program, and which she works very hard to maintain for the benefit of all of her students. And it would also make it harder to pay early childhood educators a livable wage, which is something she already struggles to do. Um, Lastly, she worried that women, and particularly immigrant women, will be disproportionately affected and face barriers to work if there's less and less access to childcare for everyone in the community, and less opportunities to work in early childhood education for those who have the education and the skill and want to work but can't due to their immigration status or their citizenship status. Um, So at a very high level, how we saw providers supporting immigrant families were in four main ways: direct support to children and families, updating protocols and training staff on their own policies, connecting families to the community through changing how they plan events so that more immigrant families who might be concerned about travel risk, the risk of being detained by ICE when they're out and about in the community, can still attend these community events. Um, and also sharing resources that includes sharing red cards or signups for Know Your Rights trainings, to referring families to community-based organizations that offer mental health counseling, workshops on on immigration law, or any other supports that a family might need. And most importantly, being a trusted source of information. So that's explaining to parents how new or proposed immigration policies might affect their family, talking families down because they, heard a rumor on social media that something might be happening. And so, like, being that trusted guide and is something that the providers we spoke to really saw their own role as. And so we do have some recommendations for federal policy, and these are based on our own Strengthening Families framework that CSSP has worked on for many years. And primarily that's, restoring protections for sensitive locations, ending family separation in all of its forms. Deportation was a huge stressor for a lot of immigrant families because many of them saw it as a form of family separation, unsurprisingly. Create a real pathway to legal status and citizenship, and guarantee access to public services. And lastly, invest in childcare and community-based providers. So I know that was a very fast run through of a fairly comprehensive brief, but I wanted to take the opportunity to see if anyone has any questions. Elisa, are there any in the chat before we move on?
I don't see any in the chat right now, but please, I want to take a moment to see if anyone has any questions. I also see that Marissa has shared Know Your Rights information on the link in a link with a link in the chat.
There's another 9:30 call we had a couple months ago now where the Mira came on and shared a little bit about some recent immigration policy changes and then also shared some of that Know Your Rights
Hmm.
resource documentation as well.
And I see Lucas has a comment in the chat about how this is so frustrating after the lessons of COVID when we saw children miss educational opportunities and we know the negative impacts it's had. And actually, that's something we did hear a lot from providers that as families are retreating, children are becoming more isolated, and there's some clear parallels with what happened under COVID. And so there are providers who talked about the potential, the immediate and also the long-term impact this will likely have on children's development.
I see a question. How many child care providers were interviewed? We interviewed 5. And as Elisa mentioned, this was really because of our focus on trying to get a rapid response understanding of what was happening. We wanted to have very focused conversations with providers over a short period of time so that we could get this information out as quickly as possible. Oh, yes, thank you. And 2 of the 5 were home-based. Yes, childcare providers.
Juliana and Elisa, I wonder if, we've talked a lot on the 9:30 call about how childcare providers can be proactive about this and sort of think about what resources and communication planning efforts they're going through and how they're communicating that to families. And I thought that was reflected really well in, I think it was Christina's comments and some of on one of the slides there. But I'm curious if you can talk any more about, did that come up in all of your interviews? Was that sort of just one example where you saw someone kind of being proactive and thinking about what this might mean and whether it's sort of the advocacy community developing resources to help programs go through that process, or you're seeing good examples of programs that are kind of doing it independently?
Do you want to take that question? I'm happy to.
No, go ahead, Juliana.
Okay. So what we heard from a lot of the providers we spoke to was that they early on, Christina had these conversations proactively, but a lot of the other providers we spoke to, many of them mentioned parents coming to them, in private and just asking like, what should I do? I'm so concerned about this. And many of them cited important resources like similar to the 9:30 call, state agencies that would provide information or resources to basically help them break down what to do in case of a visit by ICE, how to plan in their programs, and so the providers we spoke to received a ton of resources through these networks of early childhood educators that they were tapped into and were able to therefore be proactive in communicating with parents about this is what we plan to do, to try and reassure them that their children were safe in their care and that they plan to do whatever they could to protect their children. And I did have to go through these slides a little bit quickly, but they're all available. You know, Providers talked a lot about, there were a lot of things that the providers we spoke to did very proactively in terms of, say, making sure a licensed social worker was on standby to support families who were either concerned about deportation or were suddenly facing a deportation, so that they could be mobilized quickly and support the families that they serve. They talked about having to review all of their employee and student files to make sure that they had all the documentation that they needed just in case of a visit by ICE without having too much unnecessary documentation. One provider we spoke to said that parents started leaving their children's like passports or like citizenship or immigration documents in their cubbies to try and, guard against a potential improper detainment by ICE if somehow ICE agents were to come to the program. And she had to talk her parents down by saying, you don't need to do this. I promise you, these are our steps. This is how we plan to respond. In case of a visit by ICE, I have all of the information I need, and we don't want you to keep such important documents, in such a basically like we can't guarantee the safety of these documents if you're just leaving them in your children's cubbies.
It's a really important point, I think, for especially for people that have been around 3 and 4-year-olds, things happen to find their way out of cubbies and spaces. I really want to just thank you both for the presentation and the research, and then also just how you framed the conversation at the beginning too, and acknowledging how difficult this was for lots of the providers that you interviewed, and how that occasionally was an emotional conversation. So I think there's a lot of appreciation in the chat and just acknowledgement of how difficult this all is, but we're really grateful that you sort of looked into this research and are able to elevate it through the brief and through the blog. So, all right, so we will post the slides in the follow-up materials folder, and then we'll happy to share the chat with you both just so you can read that a little bit more closely as well. There's like one question we didn't quite get to in time. But again, just a lot of thanks and appreciation for the work that you both are doing.
Yeah, thank you all. And as I said at the start, really, this work was made possible by networks like these. And you heard from Juliana how helpful these networks are to providers as they're trying to support families. So thank you for all that you are doing.
Yeah.
All right. Thank you all. Have a great day. We'll be back for the 9:30 call tomorrow for sharing the mic. So open agenda and excited to hear what you all want to talk about. Have a good day.
Bye.